This month is all about heart health and taking care of yourself.
Especially your heart. UC Health is home to the region's largest and most advanced heart failure treatment center.
And we spoke with a few experts about a new device that may help improve symptoms related to heart failure. Take a look.
When patients suffer from advanced heart failure, their life can be tough. They have difficulty doing regular activities like going to the grocery store or even going to see the doctor. Heart failure is a condition where the heart no longer pumps blood the way that it should. And when that happens, the blood can back up into the lungs, causing shortness of breath, and back up into the legs, causing lower extremity edema.
A normal heart functions with the heart relaxing for the blood to pool in, and then the heart squeezes to pump the blood out to the rest of the body. In either part of these functions, if it's not functioning normally, that leads to a diagnosis of what we call heart failure. It's a grave diagnosis because untreated, it can lead to a mortality for these patients. So it's important to recognize it and then be referred to a specialist center like UC Health.
UC Health is the first heart transplant program in Cincinnati, and we've been performing heart transplants since 1985. And we serve the region by providing top 10% outcomes in transplant outcomes in the nation.
The UC Health Heart Transplant Program, being in an academic center, allows for cutting-edge research to be available to our patients.
The CardioMEMS heart failure system is a small device that's the size of a paperclip. It's implanted in the heart and gives the doctors the ability to see what pressures there are inside of the body.
And that is implanted in a small procedure, usually through our neck vein. And it's a 30 to 40 minute procedure.
Patients that have a CardioMEMS device have a benefit of having connection to their physician right from their own home. In fact, they lie on a pillow, and the pillow is able to transmit the pressures from inside their heart through the computer to their doctor. And then the physician can respond to the numbers, knowing what medications to give.
And that means that medical therapy, which allows the heart healing, is more effective when we're using these devices. Better medical therapy means that there's a chance that you may not need a heart transplant if you're doing good with your medical therapy.
It used to be that patients needed to be admitted to the hospital to qualify for the device, but now patients who have congestion, which means they're having symptoms from their heart failure, qualify for CardioMEMS. So we're trying to get the message out to let people know that CardioMEMS can help be part of the program that helps to improve symptoms in heart failure. Patients who are enrolled in clinical trials with CardioMEMS had fewer hospitalizations, and really that's the biggest effect on quality of life there is keeping our patients out of the hospital. Having heart transplant and heart failure services right here in Cincinnati is a benefit to patients in that it provides them with care right in their community.
And if you'd like, you can learn more about the leading edge treatments for patients with a failing heart at uchealth.com/heart.